Great. Good evening. My name is Jim Wilson, and I want to welcome all of you to the second installation of the seminar series sponsored by Albion College on the science, policy, and politics of COVID-19. I currently am a professor at the University of Pennsylvania working in the area of gene therapy, but a proud alumnus of Albion College. This seminar series is sponsored by the Wilson Institute of Medicine at Albion that Lisa, my wife, and I help support, whose goal is to prepare the next generation of healthcare providers. And the seminar series is one way in which we think we can contribute. Providing care in circumstances such as we are has reinforced how important it is that healthcare providers are to all of us. The format will be I will introduce our distinguished speaker, Newt Gingrich, who will say a few words, after which we will welcome a number of the Albion students to the virtual table. And they have a number of questions and really engage in a discussion with Newt. So it is a pleasure for me to introduce Newt Gingrich, former Speaker, the U.S. House of Representatives. He represented the 6th District of Georgia as a Republican for 20 years, 1979 to 1999. Newt was born in Harrisburg, PA, and educated in BA at Emory University, and then master's and PhD at Tulane University. His thesis was Belgian Education, a Policy in the Congo. Newt remains very active as a commentator, as a visionary, and is the chairman of Gingrich 360, which is a full-service consulting, educational, and media group that contributes to very important dialogues that we have regarding issues such as what we're talking about today. So with that, again, I want to thank Newt for taking the time from his schedule to spend an hour with us today, and look forward to his comments, after which I think we'll have a fun discussion. Newt, pass it over to you.
Well, let me say, first of all, that I am more than delighted. I had to turn off I had an alarm set for making sure I was with you. I had to turn it off. Anyway, I'm more than delighted to be with Jim because he and I have talked before. He is one of the great pioneers whose work literally created breakthroughs that have enabled thousands of other researchers to use the tools and the insights he developed. So to be able to, be on a program like this with him is in and of itself very cool. I'm going to take, for a minute or two, the historian's overview, and I may surprise some of you. I have a background as Speaker of the House, as an author. I used to teach history. My Ph.D. is in history. And I run a company. We've made, my wife and I have made 9 documentaries, and she's now the ambassador to the Vatican. So I approach my experience of life this year from a lot of different angles. And I had the unique experience of being in Italy. And Italy became the first Western country to really be hit by COVID, partially because there are over 100,000 Chinese workers in northern Italy. It turned out that when Chinese companies bought Italian top-end things, the equivalent of, say, Gucci or Ferragamo, that they wanted to be able to continue to say made in Italy. So their technique was to simply ship Chinese workers in to make them in Italy. Well, the result was that when the virus broke out in Wuhan, the Italian government kept open the flights, and people were flying basically from Wuhan into Milano and Bergamo in northern Italy. And so the disease spread very fast. The next thing that happened that was really weird was, and tells you a lot about the Italians. When word went out that the government was about to quarantine northern Italy, everybody jumped on the train and went to southern Italy. So the initial reaction was to actually spread the virus faster. The government then realized because originally they were going to just marginally focus on this one zone that clearly was very hard hit. Think of it as the equivalent of New York City. Instead, imagine that all of New York City had gotten in cars and ended up in the other 49 states within 2 weeks. And that's what was happening in Italy. So they then had to go to the entire country. So I found myself, along with Callista, living through a real lockdown in the sense that if you were in the street without a legitimate reason, you could be fined up to $2,300. You could walk your dog only in your immediate neighborhood. The only stores that were open were grocery stores, pharmacies, and gas stations. Everything else was closed. All restaurants were closed, etc. And of course, this was a disaster economically. I think we now know from Centers for Disease Control studies, it was a disaster in terms of general health. You isolate people and they decay. You isolate young people and they begin to have very deep depression. There's a recent study by the Centers for Disease Control, the 1 out of every 4 young Americans has contemplated suicide because of the pressure socially. So I'll come back to that in a minute. So anyway, I was watching all of this, and when it began to be obvious that the U.S. was going to have to take very strong position, I wrote a newsletter, which I do 3 newsletters a week there, free at Gingrich 360. And I wrote a newsletter and said, look, sitting here in Rome, I'm telling you, whatever you think you're going to spend, triple it. This is going to be much bigger, much harder, much more difficult. And I think I was pretty close to right. And supposedly that had a significant impact on White House thinking about the scale of the initial packages and their effort to really balance off what was going on. Having said that, these are sort of my observations, which I haven't, and frankly, I'm so involved in the re-election campaign, I'm not going to be able to do this till after the election. But I think probably next year, I'm going to try to put together a real critique of this year. First of all, the Chinese did a terrible disservice to the entire planet because they lied to everybody. I do a podcast at Gingrich 360, which are also free. And in early February, we had Dr. Fauci on. I've known Fauci since he was a great leader on HIV/AIDS in the middle of the 1980s. And so he came on the show. He was happy to talk about it. And if you go back and listen, now all these are available at Gingrich 360. If you go back and listen to him in February, he doesn't think this is going to be a big deal. Very early February now, not late February. And at that point, he's thinking, oh, maybe like SARS, it'll be a little disruptive, but it won't be a pandemic. Well, 30 days later, in my judgment, and I don't want to get into a public fight about this, but in this kind of seminar, I'll talk about it. In my judgment, the public health community panicked. And they made very narrowly focused decisions. They did not do any kind of serious decision that said, 1, if we close everything down, what's the economic cost? 2, if part of that economic cost is we bankrupt 600,000 or a million small businesses, what's the long-term cost of that? 3, if we don't have accurate data, how do we know what we're doing? And you go down a whole list, and there's a fascinating book I recommend to all of you by Murray called The Madness of Crowds, a brilliant English scholar. And it's a very troubling book because he walks through this pattern, and he blames a lot of it on social media and says, we're now in where we get these waves of emotion. So suddenly COVID is everything, forget everything else. You know, last year was something else, next year will be something else. But you have wave after wave of hysteria. And I think that at least half of the reaction to COVID has been hysteria. And because it was hysteria, you couldn't get accurate thinking. For example, the greatest single problem in New York was Governor Cuomo's decision to put people who were infected into nursing homes, which he did apparently in order to make his allies in the hospital association happy, because they didn't want them to come to the hospitals. Well, that turned out to be a total disaster, dramatically increased the death rate in New York, and probably somewhere between 6,000 and 12,000 senior citizens died unnecessarily because of what was essentially a political decision. So we're also discovering, and then this is going to, I don't yet know how bad this will be, but it's already interesting. They've had people, for example, in Palm Beach who died of a motorcycle accident, but had COVID. Well, that was listed as a COVID death. It had nothing to do with COVID. In fact, he was asymptomatic. But so we're going to find out, if we have the guts to do it, that the numbers have been grossly exaggerated, that people were queuing off the wrong things. For example, total number of cases is an almost meaningless piece of data, unless you also know the total amount of testing. And the more testing you get, the more people are going to show up. Most of them are asymptomatic. Most of them young enough they're not going to be particularly sick. And so you start making policy off that. On the other hand, you can't wait and only make policy off of deaths, because they're a lagging indicator. And I think we will discover that I used to represent the Center for Disease Control. I once helped them get $1 billion building. So in the great tradition of Washington, they loved me for a while. But the Centers for Disease Control is sitting on top of a public health system that is a disaster. I mean, every single local public health authority does their own thing. They all have their own systems. People are faxing information at a time when Walmart and Target and McDonald's know worldwide sales every night from every store. We're still getting stuff that is, if you go to the website at CDC, they'll tell you their current numbers could be up to 8 weeks late. So how do you, as a public policymaker, have any kind of effective policy decision? One last thing, I just did a podcast with a vice president of one of the companies which is working on the vaccines. And that's one of the areas that's sort of the opposite. It's why, in a way, science is an anomaly in an otherwise chaotic system. We have made so many breakthroughs analytically, and we are so good now at modeling and using artificial intelligence that we are probably on the edge of being able to produce a usable, testable vaccine in probably 1/10 the time it would have taken 25 years ago. That's really astonishing. And I think we can be very excited by the scale of breakthroughs coming down the road. I look at, in particular, for example, at the breakthroughs. We're very close to curing sickle cell anemia, which will be enormously important in the Black community. It's a very, very crippling disease. I was just interviewing last week somebody who believes that they have an ability to reverse aging for Alzheimer's, and they're in the early test stages of doing it. They've done it in mice, and they're trying to raise the resources to do it in humans. So on the one hand, I'm here to tell you, the public health system is dysfunctional and has to be profoundly rethought. A number of the decisions were based on panic, not on serious, thoughtful data. And the science that underlies all this is astonishing, getting better every month. And the number of really smart people working the solution side of this is greater than ever before in history. So in that sense, I'm strategically an optimist. So is that an okay introduction?
That sounds great. Yeah, why don't we bring the students to the table? Newton, thanks for those comments. If you guys can show yourself. Great. I think we're there. Newt, thanks for those comments. At this point, we will introduce the students. These are Albion juniors and seniors who represent a broad range of interests and backgrounds, from policy to economics to science. And I'll just call on each, and if you could introduce yourself, where you're from, and what your academic interests are. We'll start with Latrell.
Yeah, good evening, Mr. Speaker. It's a pleasure to meet you. My name is Latrell Crenshaw. I am from San Diego, California. I am currently a senior on Albion's campus. I am a major in political science. I am a minor in history and economics. And I'm also part of our President Gerald R. Ford Institute for Public Policy and Leadership and Service.
Thank you. Jared?
Good evening, Speaker Gingrich. My name is Jared Fife from Louisville, Kentucky. I'm an accounting major with a CPA emphasis, and I'm also a member of the Gerstacker Institute.
Great. Ellie?
Good evening, Ms. Speaker Gingrich. It's an honor to be able to speak with you. My name's Ellie. I'm from Bay City, Michigan. I'm currently a junior at Albion College. I'm a business major, biology minor with focus in public health. I'm a member of the Wilson Institute of Medicine and the Gerstacker Institute.
Great, thank you. Zahra?
Good evening, Speaker Gingrich. I'm Zahra. I'm a junior from the Metro Detroit area. I'm a math major and I'm in the Wilson Institute for Medicine as well as the Gerstacker Institute for Business, and I'm happy to be here today.
Great. And finally, Irene.
Good evening, Speaker Gingrich. My name is Irene Corona Vila. I am a junior at Albion College. I'm majoring in biochemistry and I am from Lawrenceville, Georgia.
Great.
Oh, cool.
So, so students, the time is yours, as they say. Newt is here to answer your question, so I'll pass it over to you guys. Who would like to get started?
I can go first. Speaker Gingrich, talking about kind of, the general policies for COVID. Should the federal government implement a federal mandate for the United States in regards to the COVID-19 pandemic? Why or why not?
Well, I think it would be a huge mistake to have a nationwide imposition. Let's take the example of masks, which is one of the arguments. A mask may make sense on a subway in New York. It would be virtually irrational in northern Idaho. I mean, people, when you compare us to Europe, people really underestimate how big we are and how diverse we are and how many different conditions we have. And so I think you've got to be careful in trying to think it through. One of the things the administration did that candidly I was very strongly in favor of was they had the entire opening up process decentralized to the 50 states. The reason I wanted that to happen is I knew that some governors would be risk takers. I would say, for example, that DeSantis in Florida or Kemp in Georgia are real risk takers. Others have states where there aren't any risks. I mean, you look at the total number of people in South Dakota who have COVID, Kristi Noem is not taking a big risk because it's basically negligible. They're going to lose more people to drunk driving accidents than they are to COVID. So I think you have to look around. And I knew that if you tried to, if you had tried to have a national reopening strategy, it would have been so bogged down in politics and would have been very hard to implement. Remember what a big percent, I think over 20% of all the deaths are two states, New York and New Jersey. So if you go there and you talk about, let's have a reopening, you're dealing with, fairly liberal governors who really believe in big government power. On the other hand, if you go to Texas, you're dealing with a governor who's a very conservative, let's take the risk, let's reopen, what have you. So I think they've been much better off to use the federal system and allow it to modulate. Different parts of the country have had different problems at different times.
Is Irene on the phone? Are you there, Irene? I think we may have lost Irene. Okay. Zahra, would you want to go next?
Yeah, so as former Speaker of the House, you understand the value of physically being together for the collective expertise of the House. So how do you think measures taken during the pandemic impact the effectiveness of local and federal policies, and what future implications do you think they have?
Well, I'm a traditionalist in the sense that I think the history of freedom is inextricably tied to legislative bodies. I always tell people, okay, presidents are just elected kings, but at the center of freedom, I once had this amazing experience about 1989 as the Soviet Union was opening up. we had a visitation from reporters from the Soviet Union. And they came to the house, and I took them on the floor of the house. And one of them was a guy from Lithuania, which had never liked the Russians, didn't like being occupied by the Soviet Union, and were very pro-American. And I had him sit where the speaker sits. And then I took two other guys who were reporters, and I had them, one got to be the vice president, and then the other got to actually stand where the president stands. Well, the guy who we put in the speaker's chair was literally trembling. And he said, "You're allowing me to be at the center of freedom." And by that, I think what he meant was that a legislative body, and this is the biggest concern I have for the precedent they set this year in the House, which I think was totally wrong. A legislative body is the collective wisdom that comes out of the dreams and the conflicts and the prejudices of everybody who's sent there. And it's a system which has grown up in the Anglo-Saxon tradition, going back to about 1415 and the signing of the Magna Carta. And I think that in that context, 1215, and in that context, to not have the House meet, to not recognize, the Speaker is not a dictator, the Speaker is not a god. The Speaker is simply the first of 435 equally elected people. And each one of those people has the right to speak with equal authority for their district. I mean, I don't care what your background is, I don't care ethnically who you are, I don't care what your political philosophy is. If you had the votes of your district, then you have been given, it's the reason we have the fasces, which are Roman, sitting up by the speakers, where the speaker sits, because they were the symbol of the voice of the people. And so I think it's terribly important that both the House and the Senate retain an ability for the individual members to come together and for the Speaker to preside over, but not dictate to, the House. And I think some of the decisions they made this year were really dangerous for the long run health of the whole political system.
Irene, you had, I know you had a question about assisted living and some questions about that. I know Newt had referred to that, how that wasn't handled well and was politicized. Maybe I could pass it over to you so you could raise your questions about that.
Yes, thank you, Dr. Wilson. Speaker Gingrich, according to the Foundation for Research of Equal Opportunity, 45% of COVID-19 related deaths occurred in nursing and assisted living facilities. Keeping this in mind, do you think there will be any reforms towards nursing assisted living facilities?
Did I what?
The reforms, do you see any reform in,
Well, there should be at two levels. One, I spent a good bit of time with former Democratic Senator Bob Kerrey, and we both co-chaired an Alzheimer's task force for 3 years. And then, not having been punished enough, we turned around and we co-chaired a task force on assisted living, which I felt deeply because my mother had spent the last years of her life in assisted living. And it's clear that you have to, here's part of the problem. Most of these facilities are underfunded and undercapitalized, and so they don't use all the technology they should have. And we probably need to rethink how we capitalize them, because we can actually provide much better capability to all of these places than they currently have. But it also tells you, this is why I said earlier, I'm tempted to go back next year and revisit this year and think about it. If you know, if you could go back to January 1, and you know that the greatest threat of death is senior citizens, you then know that you should shift your allocation of resources dramatically towards senior citizens. And you don't have to worry very much about 14-year-olds. And instead, we were like deer in the headlights. We were trying to figure out this whole system-wide problem, which wasn't a system-wide problem. It was this, the senior citizens, and in particular, senior citizens in crowded environments. So what you would have done is you would have spent a lot of effort making sure that every single nursing home facility was prepared to deal with this, and you would have spent whatever level of government funds you had to. And this includes things as simple as how do you clean them out regularly? Now Italy's opening up, so I've gone to a couple of very nice hotels here. They totally clean the room in between people. They totally clean the table in between serving at dinner or lunch. I mean, they have really thought through, this is what you have to do to be in a COVID-free environment. Well, we should have rolled into that by March 1 at the latest and said, our first goal is going to be to focus on everybody over 70, and in particular, to focus on everybody who's concentrated in senior citizen facilities. And I suspect we would have cut out almost half the deaths if we had done that.
Latrell, you want to have a question?
Sure. Mr. Speaker, currently I'm in an American political development class, and as part of that, we talk about the implications of health policy in the upcoming election and how that may play out, particularly as it relates to the COVID pandemic. And so a question I have for you is, given the debate surrounding healthcare in the United States in general, do you think that the COVID pandemic calls into question the need for a more comprehensive federal public health solution, even if it's just for emergency situations such as this? And then I also want to ask, do you think it could be argued that given that the framers wrote an institution like the Postal Service into the Constitution, that they could imagine a need for additional public services to be utilized in the future, such as a public health solution in a situation like this?
Yeah, let me draw a distinction because they're two very different issues. I think we should have a national debate about rethinking the entire public health service, because I think by any reasonable standard it failed. And I think that it's way too cumbersome, that the decentralization as it has evolved has really become a nightmare, and that you can't, it is impossible today for our public health facilities to move at the speed of modern pandemics. It's just a fact. And you really need very accurate, very timely information. It drove me crazy. I did two podcasts, one with a group called Blue Dot, which is a Canadian firm which tracks incidences of disease, in part by using depersonalized cell phone information. Things as simple as you have a sudden surge of people going into the drugstore to buy a particular kind of drug, which will tell you that you have a flu epidemic in that neighborhood. I mean, well, these guys are so good at it that they told their subscribers at the end of January, no, at the end of December, that there was something going on in Wuhan. And they turned around, and this, by the way, is 6 weeks before CDC could confirm it. They then turned around and did something that was so simple, I felt stupid when they told me. They looked at the airline schedule. And they said, where do the planes go from Wuhan? And they figured out the largest single number of flights was to Bangkok. And so they said to their subscribers, the first non-Chinese outbreak will be in Bangkok. And it wasn't sophisticated, just the airline data is all available. It's all public. It's just nobody analyzed it. Now I looked at the speed with which they did that and how slow and cumbersome and inefficient the CDC was. That's enough to drive you crazy. The second one is a company which actually provides every night laboratory data for Massachusetts and Iowa. And we cannot get the government to understand that for a relatively small amount of money, they could have this data for the whole country every single night, as opposed to being up to 8 weeks late. So on public health, I think we need a total overhaul. On the health system in general, I also think we need an overhaul, but it will surprise you. I think the overhaul should be in the direction of a much more market-oriented system. And I'll just give you one example. Everyone should have the right to know the price of everything they're about to get a contract for. I mean, if every hospital and every doctor and every drugstore and every medical technology had to tell you what it was going to cost, which you cannot get today. I mean, the system is so rigged to make sure you don't know what you're going to pay that it's astonishing. Well, you can't have a market. If I said to you, yes, you can go to Walmart, but by the way, you'll only learn what it costs when you check out. You would think that was crazy. But the health system mostly operates that way. So that would be an example of a very dramatic big change that I think would really take a great deal of waste out of the system and establish a real competition.
Newt, how do you think Italy did?
Well, Italy's a good example of the danger of a public health system, because almost invariably public health systems end up being undercapitalized. And this partly distorted our own thinking. The Italians didn't have enough intensive care units, and they didn't have enough ventilators. And they were literally in March triaging people, which is a system that comes out of military health, where if you have so many casualties, you look for who's going to die anyway and who's going to get well anyway. And then the third group is the one you treat, because that actually makes a difference. Mm-hmm. Well, and so they were saying to people over 80, we're not going to treat you. Mm-hmm. My wife actually got involved with Franklin Graham, and the Samaritan's Purse people flew an entire hospital in to northern Italy, 68 beds, 60 doctors and nurses, and they put them in the most dangerous part of northern Italy, and they were a godsend because they were insured. By contrast, because of the sheer wealth of the American system, when Cuomo said that they were worried about New York, we built a 1,200-bed hospital in the Javits Convention Center, put in 4 Army field hospitals, and moved in a 900-bed naval hospital ship. And it turned out they weren't necessary, they weren't needed. Javits, I think, out of 1,200 beds, used about 55. The Navy ship with 900 beds used about 53, because we literally over-resourced the problem. Italians had no hope of doing it. And the problem you got now here in Italy that's really worrisome is they have 14% of their economy is tourism. And of that, probably 10% is Americans. Well, we're currently not traveling. So places that would literally be full are now maybe 1/3 full. I mean, they're going to lose a huge number of hotels, a fair number of restaurants. Last year, they had 23,000 people a day at the Coliseum. This year, they're lucky to get 1,000 people a day. So they have a different set of problems. They're still wrestling with it. There's a little more COVID here than I'm comfortable with, frankly. Mm-hmm. But they claim, and again, I'm going to put claim in quotation. Mm-hmm. They claim most of it now is people returning from vacation. Mm-hmm. They go to Spain, they go to Greece, they party, they hang out on the beach, they pick up COVID, they come back to Italy. That's what their claim is. But it's a little bit higher than I'd be comfortable with. So it's probably 1 out of every 1,000 people in Rome right now has COVID. That includes asymptomatic, because they finally caught up on testing, which is the other thing. I mean, I think we do 6 times as much test as India, which is the number 2 country. It's astonishing how much. Now, some of it doesn't count, and I tried to convince the administration. When you're dealing with a pandemic, if you can't get the information in 24 to 48 hours, it's useless. And an awful lot of our early testing was taking a week or 2 weeks. So it was junk. I mean, you could cite it as a number, but it wasn't real. But they're now very close to rolling out enough real-time tests, and that'll make a huge difference. The Italians are doing the same thing. Mm-hmm. They're rolling out real-time tests. I have a friend who just went to, as an ambassador in Europe, went around to visit a bunch of countries. He had 17 tests in 2 weeks. I mean, every time you get on or off an airplane, somebody be there swabbing him. He was getting a little tired of it towards the end.
Ellie, do you have a question for Newt?
Yeah, Speaker Gingrich, as someone in the health field of politics, how do you believe our policy needs to be adjusted when we're handling situations like this in the future?
Well, I think the entire public health system has to be overhauled. I think that part of it you hope never happens again. You would hope we could establish a strong enough protocol that in the future the Chinese would feel compelled to tell us the truth. And the odds are very high that the next pandemic will come from China. And that's because it's the center of human-animal interaction. I mean, we've had the avian flu. If you just look at pandemics and epidemics for the last 70 years, it's astonishing how many of them come out of the Hong Kong or China itself. And I fully and we also this is the other thing. We need to just relax and recognize about every 10 years something's going to show up. What you have is a planet full of people who are very close to nature. I used to work with the head of NIH, who had been born in Algeria and had great sensitivity to the complexities of the third world. And he said one time at a meeting I was with him, you now live in a world where you can have a Four Seasons hotel, and 1 block away, you can have a slum occupied by people who came in the previous week from the jungle. He said, that means you've got first world people with no resistance, side by side with people who have survived 6 or 8 or 10 tropical diseases. And he said, this is just an invitation that it's going to happen over and over again. Actually brilliantly described in a small novel, some of you might know, book, some of you may want to read sometime, called Caravans by Mishner. Mishner was the deputy US consul in Kabul, Afghanistan, in 1949. And he writes about what it was like to be in Afghanistan. At one point, he's at this cocktail party with this very rich Afghan who says to him, if we sent you down on the street, you'd die within 4 days. Because there are so many pathogens wandering around down there that we grew up with and we're used to, and we build immunities, and you have none of the immunities. And it's still true. And so you get something like an Ebola, for example, which comes out of the jungle, which is probably from eating monkeys and chimpanzees. But there's an interesting example. Ebola kills you so thoroughly it can't spread very well. I mean, it's truly a horrifying disease, so you wouldn't want to test it. But it's also a containable disease because of the degree to which I think it's like 80% fatality rate.
You know, Newt, the other, just one comment, now I want to pass it back to the students, but I was involved in the early efforts around SARS and Ebola. And as quickly as support from our government was mobilized from a research standpoint, was as fast as it evaporated when the threat seemed to be eliminated. And we just need a more proactive, sustained approach because this isn't going away. It's with a mobile world that we live in. And we really haven't seen a true pandemic flu yet.
I had we have 3 embassies in Rome. The embassy to the Vatican, which my wife was the ambassador for, the embassy to Rome, and then the embassy to the United Nations food organizations. And we have a great ambassador there named Kip Tom, who's a farmer in Indiana, a really very successful family farm. I think probably 4th generation. Knows a lot. So last week he went up to Spitsbergen in northern Norway, which is where we have the world genetic seed holding place. So literally every kind of seed in the world is maintained in this storage facility in case, much like say elm disease, something came along that would wipe out a particular disease. After it disappeared, they could then reach in here and pull the seeds back out and go back and restart it. Well, in a sense, we almost need that kind of overview of potential pathogens. And to say, look, what we want to do is build an inventory where we're constantly trying to think through what are the various options. And again, it's particularly true with the various coronaviruses, that they so consistently mutate into something dangerous that at some point you'd think we would build a preventive strategy rather than a reactive strategy.
Yeah, great. So I'll pass it back to the students. More questions for Newt?
Speaker Gingrich, just had a question about, vaccines. So when a vaccine becomes available, how do you see the United States securing and distributing vaccines to the public?
Well, I have a hunch that this particular vaccine they will simply make available the way we make flu vaccines available. The U.S. government subsidizes the application of the flu vaccine because you save so much money by avoiding people having to be hospitalized that it more than pays for itself. It's one of the most profitable preventive things we do. And I'm 77. So every year I'm going to go get a flu vaccine because I know that the difference in the quality of my life between having and not having influenza is pretty dramatic. I also went and got the shingles vaccine for the same reason. Now, I don't think it should be made mandatory because I think you get into a whole range of issues. But the truth is, if most of the people who take the vaccine find out that they're protected and they don't get the disease, with each passing year, more and more people will get the vaccine and it will spread pretty rapidly. But even the most widespread of the vaccines don't get to 100% penetration.
Other questions?
Yes, Mr. Speaker, I have a question for you regarding, in general, sort of the reaction that the government had towards some of the effects of the pandemic. You've talked a little bit about the health implications of how our government responded, but in terms of emergency management, I wanted to ask you particularly about stimulus. Given a situation where Congress and the president and the executive branch can't necessarily agree on additional funding measures to support the economy in a health emergency, should the executive go around Congress if you have an instance of divided government where one party controls the House and one party controls the Senate, should the president then take it upon themselves to provide additional assistance, or should they wait for Congress to make a decision? Because I wonder if it sets a negative precedent for checks and balances between the branches if the executive takes action while Congress is still deliberating.
Yeah, I think that it's very dangerous to overdo the use of executive orders and to overdo the president trying to make all the decisions. I draw a distinction, for example, I think depending on how the law is written, if the Congress has appropriated the money, the president very often legally can redirect the money. But the president can't invent an appropriation. This is the absolute heart of the Magna Carta. I mean, it's the reason we claim the whole notion of freedom is you have the right to cut the king off. The king has to pay attention to you because otherwise they won't get any money. That literally goes back to John signing the Magna Carta, which he promptly broke. But it was a huge psychological change in the balance of power in Britain, and it's huge in this country. So I'd be very opposed to a president inventing money, but I'm not quite as opposed to presidents reallocating money. But Congress then has again, as you point out, it's a divided Congress right now, so it's not totally clear. But if you had, as we did when I was Speaker, where we had both the House and the Senate, or if the Democrats right now had both the House and the Senate, you could get into a collision. And one of the powers that the Congress has then is just to refuse to pass the money. And you can stop the government. I mean, it's a mess and it's dangerous. But presidents have, as I said earlier, presidents are simply elected kings. And you have to be very cautious about them, because sooner or later, you're going to get somebody who's nuts or somebody who's corrupt, or, and you want to have methods of bringing them under control. It's a very, I mean, I've always been fascinated in that sense with constitutional and political history, not just in the US, but around the world, and the whole effort of people to wrestle with how they govern themselves.
Other questions? Sarah?
Yeah, so I have a question that kind of takes that to the broader level a bit. So what aspects of how the federal government works together and comes to make decisions has the response to the pandemic highlighted as strong, and what aspects do you see have room to improve?
Well, I'll give you an example that I'm really bothered by. Because the House has not been in session, they're not really holding hearings that are serious. Because the Senate is Republican, they don't want to hold hearings before the presidential election. So I think the lack of oversight, and I mean this is the largest event since World War II. It's an enormous event. It's a total mess. You would think people would want to hold hearings, not gotcha hearings, but serious efforts. And I hope maybe next year we can get this, whoever's in charge, to get serious, thoughtful hearings that say, what happened? Why did it happen? What should we take from this about improving the future? Because if we don't stop and really assess this year, we will have lost a huge opportunity to understand what didn't work and to prepare ourselves, as Jim was saying earlier, for the inevitable reemergence of something. So I would say that's one of the things I'm most troubled by. I think second, without assessing any blame either way, and again, I mean, I'm a pretty tough partisan. Clinton and I once negotiated for 35 straight days, and we got to the only 4 balanced budgets in modern history the two of us produced, along with welfare reform and a whole bunch of other stuff. But it took being in the room, looking at each other, and deciding that your duty to the country was larger than whatever your political games are. It's been very disappointing to me on both sides that they have not had a greater capacity to relax and try to just communicate with each other and try to solve things. Because in a free society in the long run, if you can't get people to come together, you can't get the system to work. It's a very dangerous environment.
Other questions?
A follow-up question on that, Speaker Gingrich. So how do you think, as U.S. citizens and just residents of the United States, how do you think we should approach that situation, or what is our duty in response to the pandemic?
To the pandemic or to the current political situation?
If we're waiting for, I believe, the House to have a session.
Well, I would hope people would encourage their House and Senate members to go back and have regular sessions. I mean, I was really struck, and I wrote a newsletter about this. You know, all around America, there are firemen who are working. There are policemen who are working. There are nurses who are working. There are grocery store clerks who are working. This idea that you couldn't have the House come together. I actually testified, it was really funny. I testified by Zoom to a congressional hearing on whether or not the House should operate electronically, and found myself on Zoom telling them not to, I don't mind minor things, but it's important that these people get in the same room. And they're apparently terrified, which makes no sense. I mean, are the people at Kroger or Walmart or Target terrified? People take, you wear a mask, you wash your hands, you socially distance. You just reduce the risk by like 95%. If you're under 40, you're in greater danger of getting killed driving to work than you are by catching the disease at work. In fact, I had the head of the largest single university in the United States, Arizona State, said to me, I will lose more young people this year to drunk driving and drug overdose than I will to COVID. But we're going to spend all of our energy on COVID. And he was right, statistically.
Ellie, do you have a question? Another question?
Yeah, Speaker Gingrich, you kind of touched on this a little bit for a second, but when the government is responding to a pandemic, how do we keep the politics and the science behind the actual disease separated?
You don't. It's not possible. There's a wonderful small book, by the way, called Management and Machiavelli by Anthony Jay, who was a BBC producer and advisor to Margaret Thatcher, who wrote two absolutely brilliant TV series, one called Yes Minister and the other called Yes Prime Minister, which I recommend to you if you want to understand how government works. Anyway, Jay in Management Machiavelli says, all human institutions are political. The Vatican and the Catholic Church is political. The US Congress is political. The Metropolitan Opera is political. Because anytime you have human beings interact, it is by definition political. Now, the question is, can you focus enough on what really matters to get big things done, even though it's the politics of doing it? And I think you see periods when it all comes together, and for a little while, people decide they're going to be really serious, and they really work together, and they get them right after 9/11, for example. It was probably a period of a year when people really work together. It's also, I think, sometimes generational. I think the people who came out of World War II had such a profound sense of duty that they were much more inclined to put patriotism ahead of partisanship in a way that just decayed over time. By the time of the Vietnam War, partisanship began to outweigh traditional patriotism. And it was almost generational. You could see it with Bob Dole, who now is, I think, 96 or 97, who fought in World War II. You saw with George H.W. Bush, who was the youngest pilot in the US Navy in World War II. They really had this sense of duty. I was a baby boomer. Clinton was a baby boomer. We didn't have a clue. It wasn't our world. We hadn't been through anything like World War II. But we still came out, we were still in the shadow of our parents. So we still had a much greater sense of that we're there to serve the country. And yeah, we're going to elbow each other and we're going to try to get partisan advantage. But ultimately, we're there to serve the country. And I think that's sort of decayed in the last 25 years. And you have people who, I'd rather hurt you than fix something for the country. And your reaction is you'd rather hurt me than fix something for the country. Well, that makes it really hard sometimes to get the system to work right. But you see these cycles in history. They're not. That's why I'm a historian. I mean, it's really interesting to watch over time. And presently, a generation will come along and say, enough of that crap. I'm not, I'm here for a totally different reason. And, we will sort of mosey onward.
One aspect of sort of the conflict around science, communication, and politics is the reality that despite the fact we're incredibly sophisticated from a scientific standpoint, there's a lot more that we don't know than we do know. And being a physician who communicates with patients, the public and patients view things in a binary way. Is it safe? Is it not safe? And those that are responsible for policy and decisions who really don't have a scientific background, it creates a real tension that I think is just inherent in the uncertainty of science, especially in emerging new science. And I don't know if there's any real solution to that other than we try to make the best decisions we can based on the facts we have. And then the facts change. And that's not wrong. That's just sort of the way it is. I think we have time for one more question. So which student would like to have the last question, and then we'll give Newt the final word.
If no other student minds, I would like to ask a question.
Please.
Speaker Gingrich, with anticipating change, what kind of changes do you foresee in regards to healthcare?
Well, I don't quite know yet, because I think it will partly depend on the politics of the next few years. But I think that the long-term trend of the technologies that are evolving put more and more power in your hands. I mean, I find myself, just like I'm sitting in Rome talking to you, you know, and to me, that's astonishing. When I was a kid, my dad was in the Army, and we lived in Orléans, France. You had to go to the central post office to call Paris to talk to the Atlantic trunk line operator to find out what time you could make a reservation to call back to the US. And then one day I was driving on the Autobahn, and my older daughter was in Paris, and she's on her cell phone and I'm on my cell phone. And I thought, this is a revolution. This is so dramatically different. So I think that the bias of the system is to lower cost, have greater convenience, make it more personalized, make it faster, and transfer more and more power to the patient. Just as we transfer power. You think about Amazon. Amazon's a gigantic system of aggregating over 1 million choices so you can go in and find the one thing you want. Well, if you think about that, that's an amazing pattern of transfer. So I am a strategic optimist. I used to work with Alvin and Heidi Toffler, whose two great works, Future Shock and The Third Wave, are still relevant. I recommend them to you very highly. We're in the early stages of a revolution in capabilities, which by the end of your lifetime is going to, you know, you or your children will be on Mars and probably out at least as far as Jupiter. You will be doing things underwater that would currently seem like science fiction, and you'll have access to levels of information. And by the way, you're going to do it on a planet which probably by the end of your lifetime will have about 6 billion people, because we're in fact failing to reproduce. And so we're actually going to, instead of having a population explosion, our next great worry will be that we don't have enough people, which is just, you know, as a historian, I love watching these patterns evolve. But I want to say, Jim, thank you for really creating a terrific opportunity. You obviously attract some very, very bright people. I hope all of you go on to wonderful careers. And I hope you have a sense of optimism that you ain't seen nothing yet, and that we have an amazing future for all of us. And we just need to roll up our sleeves and go create it.
Well, Newt, thank you for your public service during your career and your ongoing engagement. It's critically important as a time like this to lean on experience. And thank you for taking the time with our students here. I'm sure they enjoyed it. And Godspeed, everyone. Stay well.
Thank you. Have a great day, guys.
All right, take care.